All righty, hello, and welcome to the Town Meeting Program, your local talk show on KLAM here on the 27th in the 10 a.m. hour on AM 1450, or heard at your leisure once this program is uploaded to youtube.com/Cordova TV, which will happen as soon as Robbie can get that done after we're actually done doing it on the radio here. Pleased to have you listening, of course, as we move ever closer to a special meeting of the City Council at noon today, May 27th. Our show here is brought to you by Cordova Wireless Communications, your local provider of cell phone and wireless data services that also provides your local talk program. And on the agenda, actually what we'll start with, in case you didn't have a chance to hear it, and I will confess right up front that I didn't have time to hear it yesterday. We'll begin with yesterday's afternoon briefing with, and this is not the daily briefing we do on the radio, but the city's briefing on their YouTube channel. We'll hear what Mayor Copeland had to say. He was the one at the desk there in the Cordova Center. And if he covers a lot of the things I thought that I was going to have to cover, then that'll save us time and we can hear it direct from the source. So we'll begin there, and then, again, previewing the special meeting, sharing some information from the local doctors regarding reopening, go over the potential changes to the mask rule, and if we have time, which I hope we will, also share a letter from Dr. Rush regarding this guidance that came from Dr. Zink last week, the week before, whenever it was. I don't know, it's, it all mushes together, of course. But this idea of expanding your social contacts, or bubbles, as they're calling, expanding your social bubble beyond your household and selecting a carefully chosen few to begin to interact with that are outside of your household. And Dr. Rush has written a great letter about that, and I want to share that, along with some legislature updates from Senator Stevens. So hopefully we'll be able to get to all of that here today. We'll start, though, as I said, with yesterday's briefing from the city, hosted by the mayor.
Good afternoon, Cordova. On this Tuesday afternoon, May 26th, 2020. Hope you had a great Memorial Day weekend. And here is our community update for Tuesday, May 26th. So reopening Cordova. On Wednesday, the special city council meeting, your representatives will be discussing whether to move to a 100% reopen plan put in place by Governor Dunleavy or to remain at phase 2. This would be a good time to send your comments in to council members and share your thoughts and opinions. You can read the agenda on the City of Cordova's website at www.cityofcordova.net. So again, that's a special meeting Wednesday at noon regarding the reopen of Cordova. Expanding your social bubble. In answer to a Cordova prepared email we received about expanding your family's social bubble to include elders or other family members or friends, Dr. Sanders shared this response. This is hard. We want people to get back to what will become normal with social distancing, hand hygiene, cloth face covers intact. This does not mean a return to pre-COVID life. A coronavirus has not got here to our community yet. It likely will soon, just as we knew it would with the influx of people, and that influx has only just begun. One isolated case gave us a tiny test, but we have yet to see the illness really arrive to town. I expect that we will soon. This is still a very dangerous disease. Each person we contact and spend time with, without protection, increases our web of contact. If we go back to pre-COVID life, we'll not be looking at that flat curve that we currently have today. People must continue cautiously. With a tight-knit community, the web of contagion contact can reach through town quickly if we're not cautious. Just as with every other disease and safety guidance we give people, we always rely on individual compliance to keep themselves and their families healthy. In my opinion, wearing a mask, social distancing, hand hygiene, avoiding large groups, and contact with non-household members falls into the same group of advice as eating healthy, exercising, wearing a seatbelt, helmet, not drinking and driving. People have to make choices for themselves and for our community. Each family and group have to make their own decisions. I always tell people to follow their gut. So that's our guidance from Dr. Sanders as we relax requirements, but we don't want to relax the behaviors that have kept the coronavirus from impacting our community. We have some good news on the hand sanitizer front for local businesses. With the assistance of the folks at Napa, the city of Cordova has been able to purchase hand sanitizer for local businesses. The sanitizer is first being distributed to first responders and then through Napa to local businesses. There's no charge for this, but the quantities will be limited. Distribution will be taking place this week. Please call Napa first. Work continues to obtain both dispensers and additional hand sanitizer for the season and foreseeable future. Thanks again to Napa and the city of Cordova. And again, one of the challenges to reopening businesses are the many requirements, including hand sanitizer, which has not been available. So we thank Napa and the city of Cordova for getting some to help our business community to reopen. We have an update on a summer road closure in the community. Trident Seafoods, with the permission of the city and incident management team, will be closing down Jimpour Avenue in front of their facility and Marine Way. This will consist of 3 roadblocks, including Jimpour Avenue and Breakwater Avenue, the Jimpour Avenue and Haida Lane, and Marine Way and Industrial Road. So again, we'd like to remind you of our COVID-19 info line, and that number is 424-INFO. The city of Cordova is pleased to announce the establishment of this dedicated phone line managed by knowledgeable staff to help answer your questions regarding COVID-19 crisis. Here's just some of the information you might need to ask for. A list of phone numbers for local assistance groups, links and numbers for state financial and food assistance, current information on Cordova health mandates, Reopen Alaska current phase data and implementation specific to Cordova. Help people find the many forms and information on the City of Cordova COVID-19 and Cordova Chamber of Commerce websites. Info on where and when people can be tested at CCMC and Alaka Clinic. A place where anyone can voice questions and concerns and hopefully find answers about COVID-19 and what we as a community are doing to mitigate its effects. So some other updates: masks. Wearing masks in Cordova is still a community emergency rule. Both the State of Alaska Medical Director, Dr. Ann Zink, and Cordova's medical team, led by Dr. Hannah Sanders, strongly encourage wearing masks in public places at all times. Currently, everyone is required to wear masks at all times on the docks, in the harbor, and while in public places and local businesses, including the gas station. Remember that it protects you, but more importantly, it protects someone else. Masks slow the spread of coronavirus. Protect each other, our fishery, and our elders by wearing a mask indoors when with non-household members and when you're within 6 feet of others outdoors. An update on test results. Here are the test results for our community for the period ending Sunday, May 24th, midnight. 397 tests have been conducted. There have been 1 active test result. 392 tests came back negative, and 4 tests are awaiting results. Our community currently has testing capacity of over 1,100 tests. So we do have drive-up testing still available to all for free. Mondays and Wednesdays, 2 to 4 p.m. at the Alanka Community Health Center, downstairs across from the Episcopal Church. On Tuesday, Thursday, and Friday from 2 to 4 p.m., testing is available at the Cordova Community Medical Center in the ambulance bay. At the Alanka Center, please call ahead at 424-3622. And at the Cordova Community Medical Center, please call ahead at 424-8000. To complete a required pre-registration, this will save you time. Please call if you're unable to access a test at those times, and the folks will make arrangements to accommodate your schedule. How long does it take to get test results? It depends on the type of test, but results are usually back in 1 to 2 days or sooner. We encourage the community to look at testing as positive progress. Testing empowers the community, and with assistance from the state of Alaska and the efforts of our unified medical teams, we're now able to offer this expanded service. Testing is knowledge. A kudos and a round of applause. 3 cheers to our harbor and airport ambassador teams who are spreading the word about local rules, where to get information, and distributing sanitizer and masks. The work they do each day is keeping our community safe, educated, and informed, and we thank them, and please, you thank them when you see them. Health and well-being. With the assistance of Sound Alternatives, the COVID-19 website now has a tab labeled Coping with COVID-19. This link provides tons of useful information on how to maintain your own health and your mental well-being during these difficult times. We hope it'll provide assistance to anyone struggling through this event. Are you wondering how to talk to your children about COVID-19 disease? Cordova Community Medical Center and Sound Alternatives have provided a link to the Emory Global Health Institute's COVID-19 Children's ebook winners. We will be posting the link on the Cordova Prepared page on Facebook. State of Alaska Health Mandate number 18. Intrastate travel between communities located on the road system and or the marine highway system is permitted for all purposes. Note, travelers may travel between the road system and marine highway system communities via any normal means of transportation, including vehicles, boats, ferries, aircraft, and commercial air carriers. So the rules in place. This is a reminder about other current rules besides facial coverings for our community in the yellow phase of reopening. Quarantine. Anyone arriving in Cordova from out of state, including residents of Cordova, must self-quarantine for 14 days. The only exemption is for essential healthcare and emergency service employees. So if you're a Cordova resident but are returning after being out of state, you will have to self-quarantine for 14 days. Social distancing requirement. Gatherings of no more than 50 people are allowed, but you must still maintain a social distance of 6 feet. Please be respectful of the businesses and the protective measures they put in place as they strive to serve our community and reopen. Thank them for the measures they're taking to keep us and their employees safe. For business assistance, businesses who are reopening can reach out to the Cordova Chamber of Commerce for their informational Come Back Better campaign packets. Links to all of the Chamber's information are also on the COVID-19 website. As we slowly reopen local businesses in our community, please remember to follow the guidelines, and this includes completing a mutual aid agreement with the city. The mutual aid agreement fillable online forms are available on the website at covid19.cityofcordova.net. So in closing, radio briefs will continue daily on our local radio stations, KCDV FM 100.9 and KLAM AM 1450 at 1, 5, and 8 p.m. each day. These will be updated as often as possible. The live community updates that we're hosting right now will be held on Tuesdays at 4 p.m., and those will include detailed information and occasionally special guests. All information is available on our Cordova COVID-19 website. Watch for new information at covid19.cityofcordova.net. City Council will have a special meeting Wednesday, May 27th, and the community can listen in or call in and participate via our YouTube channel. A link is on the city's website. So have a good week, Cordova, and safe fishing to our fleet.
Okay, so that was yesterday's city briefing. Those again happen Tuesdays at 4 p.m. on the city's YouTube channel. You're listening to the Town Meeting Talk Show for May 27th. Today is the day for that special city council meeting, which, you know, has the potential to be a pretty significant one. And because the issues being discussed are issues that a lot of people have been talking about in local chatter, it would be a real good one for anybody who has an opinion on the mask situation, the businesses reopening situation, to plan to participate using the phone-in testimony. And if the phone system, if they have trouble with that, they go to email as a backup. So you might want to have your computer or your phone or whatever fired up to potentially send in email. But that call-in number, 253-6202, they put you on hold, you hear some music. Remember, of course, that what you see on YouTube is about a minute to a minute and a half behind real time. So they may come to you on your phone before you see them coming to you on your computer. So while you're holding to offer testimony, remember to listen in your phone and don't rely on what you see on the YouTube feed. Because otherwise they end up having to come to you multiple times, and if you're completely out of it and not realizing that it's your turn, they may have to move on. So the main resolution that they are covering in today's meeting at noon, Resolution 052023, here's the formal wording. A resolution of the City Council adopting recommendations of the Incident Management Team Medical Unit of Medical Directors confirming implementation of Phases 3 and 4 of the state's Reopen Alaska Responsibly plan effective June 1st, 2020 within city boundaries, so long as the city temporary emergency COVID-19 rules remain in effect. That's the first part. And then also an additional part here, the resolution would ratify an amendment to Emergency Rule 15 on facial coverings as outlined in the latest revision of the Emergency Order 2020. This would be 2020-08, and we're going to go over that here in a sec. So again, in a nutshell, do they want to revise the mask rule to make some accommodations for obvious things like eating in restaurants and so forth, because you can't eat or drink through a mask? So that's what the changes have to do with. And again, we'll go over those shortly. But kind of even more significant than that, essentially, does the City Council want to move Cordova to be in sync with the state as far as the reopening plan? And those are things that you'll want to weigh in on if you offer testimony this afternoon. Now, if you've been following this, something you know that at least a majority of the council has pretty consistently wanted to do is to follow the guidance of the medical team. Often what happens is when the local doctors weigh in on some change the state decides to make, the council has a tendency to follow that. Not unanimously. There are differing views, obviously. But that tends to be what guides the majority of the votes. So with that in mind, if you're wondering what the doctors would like to see happen, I wanted to go through for you here the statement from Dr. Sanders as to whether or not things should move forward. And here's what she says. At this point, the metrics to reevaluate reopening, like healthcare capacity and epidemiological data, suggest we are ready to align with the state. The medical team is concerned this reopening will be interpreted as a relaxing of basic guidance. We must also remember that due to Alaska's early quarantine for out-of-state visitors, we have not been exposed to the virus at the rate of the lower 48. Now, with the arrival of hundreds of out-of-state processors, fishermen, and returning residents, our risk is as high as ever. As the state and the community reopen, we must exercise continued vigilance in our efforts to mitigate the risk of virus spread. To put it simply, wearing masks in combination with frequent hand washing and social distancing works to help reduce the spread of the virus. Masks are much safer than no mask. Outdoors are safer than indoors. Fewer people are safer than more people. And the more time you spend in close proximity to others outside of your household, the more likely you are to become infected or infect others. Our local processors and industry partners have put extensive time and investment into plans to protect their operations and our community. They've done this largely without mandates regulating how they respond. I believe, and again, this is Dr. Sanders talking, I believe we owe each other the same level of protection. Businesses have the right to require hand hygiene, masks, and to only allow for small numbers of patrons or curbside service. Regardless if it's a mandate, a business requirement, or individual decisions, the medical community encourages everyone to help protect Cordova. Dr. Sanders says, "My personal opinion is that we can trust businesses and individuals to do the right thing and allow individuals to make their own decisions regarding safe reopening. If there are questions or a business would like guidance, the medical team is here to provide advice and support. To this point, our response and each Cordovan sacrifice has protected our community. Let's not let that go to waste." End quote. She brings up an interesting point that we talked about in yesterday's update with Mayor Copeland, the daily briefing, in that it's an interesting point of view, and one obviously that won't be shared by everybody, but an interesting point of view to look at the success that the processors, not just in Cordova, but around the state, have had so far with their testing regimen and their regulations, which are significantly stricter than what's coming out of the governor's office. The administration has continued to loosen things for the business community as a whole, but the processors have stayed with their very strict plans. And as a result of that, they have managed to catch cases before their facilities turned into hotspots because of how aggressive they are with the testing. So, for example, one thing that Mayor Copeland shared with us yesterday that businesses that are reopening might want to consider, since there's free testing available, it'd probably be a good idea, not mandatory, but a good idea for all of the businesses' employees and the owner and anybody who has contact with the public to go get tested. Get tested in advance of reopening or as part of reopening. So you basically are putting the same protection in for your business that the processors have been doing and theoretically could achieve the same success not having an asymptomatic employee on the front lines. And, of course, if you have a symptomatic employee, send them home. Don't let them work. I mean, that's a universally accepted truth of this temporary new normal. And, of course, Dr. Sanders in the letter also pointed out something that is important, which is that businesses are not required to relax their operations to the same level that the state says they can. The state sets a minimum, but each individual business, for the protection of its customers and its employees and whatever, each individual business is a free entity that is allowed to make its own decisions. If they don't want to, if a restaurant doesn't want to open up to dine in, or a retailer doesn't want to open up to having people in the shop, if they still want to do curbside only, those businesses have an absolute right to do that. And really, it's kind of odd. I don't know if we've been having this problem locally or not, but I certainly see stories about it at the state and national level where the same folks who are very vocal about constitutional rights and governments, the government shouldn't put mandates in place. That's wrong. Let the free market do its thing. Let individuals make decisions about what's good or bad in this situation. And some of those same folks, not all, but some of those same folks will then turn around and get really angry at businesses who choose, as participants in the free market and as free, entities, choose to have more restrictive policies, like you have to wear a mask to come in. And you'll get people wagging their fists in the air and saying, "How dare you, business?" People did this with Costco when Costco put its masking rule in place. Costco isn't the government. Costco is not violating your constitutional rights by saying that you have to wear a mask when you go to Costco, or any other business that does the same thing. If the business has a policy, you've got to be masked when you go in there, then you've got to be masked when you go in there. And in fact, really to put the screws to a business that's doing that, you're in a way you're really bullying them out of their free market rights. If you don't like a business's practice, you can go to a different business. But trying to tear a business a new one because they have some tighter restrictions is that's particularly, again, if 5 minutes ago you were saying constitutional rights and government stay out of it and let private people do it. I don't know how folks resolve that in their head, actually. But the fact is the businesses can have tighter policies. Now, as I understand it, the business cannot entirely refuse you service. Say if they have a masking rule and you don't want to wear a mask and they say, well, sorry, you can't come in. I believe they're obligated to say you can't come in, but we'll give you curbside service if you want. If there's something you're interested in, we will bring it to you. And it's possible, again, understand it's possible. I'm guessing here. That's what I am pretty sure I remember hearing, but I'm not sure 100%. But it's just, something to keep in mind as this whole thing evolves. Each business turns in its own plan to the city, and that's required. Remember, business owners, if you've been closed and you're going to reopen, now that we would appear to be on the verge of joining with the rest of the state, make sure your mutual aid agreement is on file with the city, because any of us, even our operation, where we don't have members of the public in and we don't really interact with members of the public, but we still have our mutual aid agreement on file. And it's not hard to fill out, but you get that turned into the city and then you have the green light to do your thing. Now, to drill a little deeper into the recommendations that the medical team has provided to council, which is important, again, because the council tends to, so far, has tended to follow the recommendations of the medical team under the assumption that those are the experts that know what's best for Cordova. What works for Anchorage, what works for Fairbanks, what works for Glen Allen or some other place may not necessarily be right for here, is their thinking. So they make these recommendations. But they are in favor, as we said earlier, of moving to being in sync with the state with some conditions, which, of course, the council will have to decide on because they're the policymakers, and conditions that you can weigh in on as members of the public, because those are all the things that are in the soup when council's considering this stuff. Medical input, public input, the council members' own experiences and beliefs as elected officials, and so forth. So here's another document that's in the packet, and we'll give you some perspective on where the medical team stands. This is Cordova's medical unit, medical directors' recommendations to council regarding phases 3 and 4 of the State of Alaska Reopen Alaska Responsibly Plan. That's where the rest of the state is right now. Dear council members, upon careful review of the State of Alaska public health mandates and Reopen Alaska Plan phases 3 and 4, Cordova's medical unit medical directors, a.k.a. the Cordova medical team, recommends the following actions by the city to implement phases 3 and 4 of the State of Alaska Reopen Alaska Responsibly Plan, effective June 1st, so long as the city continues to impose the temporary COVID-19 emergency rules. By the way, just to clear up a little confusion, you're going to hear a lot about moving to phases 3 and 4. What that means in reality is the state just jumped over phase 3 and went directly to phase 4. I'm not sure why the state even said this is the combined phase 3 and 4 thing, because they didn't really. So that's sort of weird. So anytime you hear going to phases 3 and 4, think in your head doing what what the rest of the state is doing. So again, the medical team wants to go to this new phase as long as the city continues with its temporary emergency rules. And here's how they detail that. The Cordova medical team understands the need to lift business operation and social distancing restrictions as quickly as reasonable but it's also obligated to recommend restrictions that protect and preserve public health and safety. In making its determination, the Cordova medical team applied the state plan metric analysis, which weighs epidemiology, testing, public health capacity, and healthcare capacity in determining the social distancing and business operation restrictions necessary within the city to protect the Cordova community and its visitors. Under the section of epidemiology, the team says in weighing this factor, the Cordova medical team considers COVID-19 disease trends and trend forecasting. Currently, it appears COVID-19 cases within the state are declining. However, the city of Cordova recorded its first COVID-19 case, and nearby Valdez recently had their first positive case. Further, the influx of summer workers and the arrival of the fishing fleet requires the city of Cordova to carefully monitor for COVID-19 transmission within Cordova to determine anticipated trends specific to Cordova. Under the subject of testing, Cordova's ability and capacity to screen and test widely continues to increase. Both CCMC and Alanka Clinic are providing free testing to essential workers and those arriving to Cordova from out of state who have not yet completed the 14-day quarantine. Actually, and that's been expanded to everybody. So that part seems dated, but at any rate, expanded testing. That said, the Cordova medical team is working diligently to determine the capacity of testing and the need for testing in light of the recent influx of summer workers. In light of the new increased testing capacity, the team continues to develop methods and internal protocols for monitoring overall testing volume and changes in the percentage of positive tests at the community, regional, and statewide levels, ensuring fast turnaround of tests and reporting of results. Moving to the third item, public health capacity, the Cordova medical team has only one case for which monitoring and contact investigations have been required. The team has found that individual businesses are working diligently to protect their employees and follow their own protocols and protective measures. Although the Cordova medical team is monitoring cases and conducting necessary contact investigations for positive cases, the independent efforts of business owners operating in Cordova warrants transitioning to open business operations with minimal restrictions so long as the state of Alaska advisory documents and mandates continue to be followed. And then finally, with healthcare capacity, the Cordova medical team is prepared to treat and respond to multiple cases of COVID-19 within the city, but also recognizes that CCMC hospital facilities do not have the type of facilities necessary to treat severe cases of COVID-19. To protect hospital staff, patients, and the greater Cordova community, COVID-19 patients will be transported to Anchorage or other communities that have the facilities, staff, and equipment to care for those requiring intensive care. The state of Alaska has indicated that it will provide medical transportation out of Cordova, which decreases our risk. The Cordova medical team estimates it has sufficient PPE for all healthcare workers and first responders, but continues to focus on building up Cordova's reserves. The city also continues to have sufficient shelter capacity. I remember that commitment, by the way, from the state that, if we were to have an outbreak or something, that National Guard aircraft or something, that they would assist with transporting people out. And, of course, our hospital is a critical access hospital anyway. So flying COVID patients out, the ones that are really sick, is not any different than what they do with most other conditions. Mild cases can be treated locally, but anything severe, heart attack, severe respiratory issue, all of those life-threatening conditions are dealt with by medevac. So that really that's not a dramatic difference in how our local hospital responds to severe cases. It's just an expansion of it and a reminder of it. So, what are the recommendations of the team? At the end of all that, they say, after Cordova's first COVID-19 positive case, The city has not yet had another, which suggests social distancing and business operation restrictions are effective. Consequently, the medical team is growing more confident in Cordova's ability to respond to an increase in COVID-19 cases in the upcoming weeks and months. The city's preparedness to respond to COVID-19 justifies lifting restrictions as recommended above, but does not yet warrant repealing the city's COVID-19 emergency rules, which include a facial covering requirement and certain local agreements and notifications regarding sanitation and protection measures adopted by individual businesses operating within Cordova. Instead, the metric analysis supports the Cordova medical team's recommendation that a transition to phases 3 and 4, that's getting in sync with the state, a transition to synchronizing with the state plan, take effect on June 1st unless the spread of COVID-19 within the city requires otherwise. For all the reasons stated above, the Cordova medical team respectfully requests Council adopt the recommendations included above. The undersigned will be available to answer Council's questions at the meeting, blah, blah, signed Dr. Sanders. So what the doctors are recommending pretty clearly is go ahead and get in sync with the state, provided that those provisions in the city's emergency order, like the masking rule, stay in place. And again, you can look at the emergency order. It's online. In fact, all this stuff I'm reading to you is online. It's in the packet for today's council meeting. If you look that up for special meeting May 27th at noon, you can read these two documents I've shared with you and also get a closer look at the agenda and the standing emergency order. Now, speaking of that emergency order, they're looking at taking that to... It's been 2020-07, I'm pretty sure, and they are looking at taking that to a new iteration that revises what they call Rule 15, which is the masking rule. And I'll read it to you as it was amended. Remember, it had some specifics about when you go into a building, if you're in the harbor, if you're on the docks or ramps, if you're pumping gas, and that kind of thing. They have simplified that to a degree in this revision, and here's what it looks like as proposed. Rule 15, facial coverings. Except as otherwise provided in this rule, all individuals in Cordova must wear a mask, bandana, or other type of cloth protective covering over their nose and mouth when social distancing from another individual of at least 6 feet is not possible. Individuals under the age of 4, individuals with trouble breathing, and individuals with a medical condition that prevents them from wearing a facial covering are exempt from this rule. Facial coverings need not be worn in the following circumstances. Number 1, an individual is alone or within 6 feet of only members of his or her household. Number 2, an individual is eating or drinking in compliance with state of Alaska public health mandates. And number 3, an individual is receiving lawful services that cannot be adequately performed while the service provider or the recipient is wearing a mask. So people have been, saying, hey, if the restaurant's open, if I'm going to sit in a restaurant, what am I supposed to do? Well, obviously, this acknowledges you can't eat or drink through a mask, so you pull it down. And if there's nobody other than your household members at your table, and you're 6 feet away from anybody else, or whatever the minimum distance is in that restaurant, then obviously you're all right. So basically they're simplifying it. If you want it in a nutshell, they're simplifying it to say you've got to have the mask on if you're going to be coming in contact with anybody outside of your immediate household, out in public. And the doctors, again, very much want that rule and the other provisions of the city's emergency order to stay in place in order to sign off on moving to this much more relaxed phase of reopening the businesses. And dropping a mask would not be limited just to eating. I suppose if you were, at a barber and were having your beard groomed, you can't really do that with a mask on. So things like that, they're obviously recognizing that there have to be some reasonable exceptions in order to receive services that are allowed. So, and again, if you want to read this, it's on the city website. It's part of the packet for today's meeting. And if you want to testify about it, because there are some people that might think, hey, this is too relaxed. There are other people that might think Rule 15 should go away completely. And there are others that might want to support this version of it. That's America. That's the diversity of opinion. But public input impacts, it's one of the factors, remember, that the council considers, along with the doctors and the other guidance that they get and the legal guidance and so forth. So be sure to speak about this if you have any thoughts regarding it. Okay, so that summarizes what's coming up at the council meeting today. They're going to talk about whether or not to move into sync with the state in terms of operating businesses, and also some modifications to the mask rule. How are we doing on time? We're good. Okay, good. I really wanted to have time to share this with you because I got to take a look at this letter by Dr. Rush about this idea of expanding what Dr. Zink called when she initially put this out for the state, expanding social bubbles. In other words, up to now, your bubble has just been your household. You can freely intermingle with people in your household without social distancing and masks and all of that stuff. But anybody outside of your immediate household, it was supposed to be minimum of 6 feet, wear the mask and that sort of stuff. As the doctors have learned more about how the disease spreads and have been able to monitor its prevalence, in terms of this, what they call community spread. How much is it passing between residents in communities? Dr. Zink came out with some guidance a while back about people starting to, especially folks that are going nuts, not being able to interact with other people, recommending that households could take some carefully thought out gradual steps toward interacting with select people outside of their own household. And to put a local spin on that, we have this fun letter from Dr. Rush that I asked if she would email me so I could share it with you. And it's called Expanding Your Bubble Safely, How to Do the Double Bubble. Double bubbling is not a new dance that's sweeping the nation, nor is it an online dating service. It's the new terminology for easing up on the restrictions of isolating within your designated family circle or bubble. Sometimes they call it quarantining. Up until this point, Alaskans have been encouraged to stay within their immediate unit and stay in isolation from other families. The state has now moved to newer phases, and the Alaska Department of Health and Social Services, as of May 15th, deemed it safe to cautiously expand your bubble to a single other family. That means your child can officially have play dates again without looking over your shoulder for the quarantine police. It means that the two families in quarantine do not have to wear face masks or social distance. But, there's always a but these days, it does not mean that you can start having play dates or women's night out with multiple kids or BFFs. To be clear, double bubbling means just that. You pick one family that you can socialize with in any setting, in your house, in their car, on your boat, or in the bar. That rhymes. It does not mean you can pick another bubble every week and make it your new bubble. It does not mean that each of your 5 children can have a different family bubble family to join. And it certainly doesn't mean you can jump in with 3 or 4 different bubbles at the same time. Bubble baths are strictly prohibited. I see what she did there. This is not like dating when you're 18. This is a marriage-level commitment to your quarantine. I love this letter. Dr. Rush goes on to say, although I'm writing the above in a lighthearted manner, I want to be very clear that the stakes of expanding our social contacts are deadly serious. It is possible that if we do not continue to follow the recommendations of Dr. Zink and the DHSS, we could see a resurgence of the virus with very dire consequences. Expanding your bubble means that you don't have to wear masks within the 2-family or 2-friend units. But if you're gathering with multiple families or in restaurants or in bars with your expanded bubble, you should still wear a mask and follow social distancing, practice frequent hand washing, and avoid touching surfaces and your face and your eyes. This is a crucial time for Alaska and Cordova. If we see a major jump in the cases, we'll likely need to go back to stricter social isolation again. It's also advised that the vulnerable elderly, those in high-risk professions, or those who have high-risk conditions carefully consider the risks before expanding their bubble for obvious reasons. So let's do this right so we can continue to move forward safely. But in the meantime, pick your bubble wisely, my friends. You could be together for a while. Cordova has done an amazing job at hunkering down and preventing the emergence of community spread. As we move on, it's more important than ever to continue to follow the recommendations to keep our community healthy and disease-free. Very well written, Dr. Rush, and thank you for letting me share that. I personally feel it's important to reemphasize the fact that, if you say your household is mom, dad, and 2 kids, and another household is mom, dad, 2 kids, and a grandma that lives in that household, there's an argument to be made that that other family might not be a good one to connect with because of the potential for the virus to be carried into that household with the elderly person. I mean, obviously, that's what Dr. Rush was talking about in there. But so that's why, when you hear this expansion of social contact, it has to obviously be very carefully considered intermingling so you don't put especially the most vulnerable people at risk. Because, just try to imagine how lousy it would feel to be responsible for giving that to a vulnerable person for whom it could be fatal. I don't think I'd ever sleep again. So hopefully the community will apply wisdom and special care for protecting the most vulnerable. Got just enough time here to sneak in the latest Capitol report from Senator Gary Stevens. Again, want to remind you the key thing we've been talking about today is the council meeting this afternoon, at noon, actually, which you can see live on the YouTube channel. And you should definitely testify if there are aspects of this whole pandemic response that you want to get on the record. This program, by the way, if you're joining it late or want to hear it again or hear it slower or whatever, will be on our YouTube channel, youtube.com/Cordova TV, fairly soon after we're done here. In this report from Senator Gary Stevens, he talked about the passing of the CARES Act. Well, the agreeing to accept and disperse CARES Act funds. These are the federal funds for coronavirus aid. Alaska got $1.5 billion in federal coronavirus aid to be distributed throughout the state. If you're curious, it allocates $568 million for community assistance, $290 million in grants for small business, $51.6 million for statewide aviation, rural airports, and the Whittier Tunnel, $50 million in grants for the fishing industry, $45 million for K-12 education, $42 million for child nutrition programs, $29 million for rural transportation costs, including the Marine Highway, $10 million for homeless assistance, $5 million for the University of Alaska and its students, and $3.6 million for state and local law enforcement. And again, all of that has to, by federal rule, has to be spent on compensating those various areas for COVID-related hardship. And if you want to know more about it, by the way, the Chamber of Commerce is an excellent point of contact, especially if you're a business that would like to access some of the grants or any of those areas. Stevens goes on to say, as far as what's ahead in the interim, that it's likely the legislature will be called into special session in the fall to vote on the governor's appointments to the state's many boards and commissions. If the confirmation hearing does not occur, the governor would have to provide the legislature with a completely new slate of employees next session. We may also be called into special session to vote on budgetary and any other matters that need to be considered before the end of the year. Stevens says, of course, we will be keeping close watch on the impacts of COVID-19 as Alaska's economy reopens. I believe the governor is getting good advice from medical experts on reopening, and I am optimistic that Alaska has the resources and know-how to do this safely. July PFD distribution. Stevens says, as you may have heard, the governor has moved up the distribution of this year's permanent fund dividend to July. PFD payments for eligible Alaskans start Wednesday, July 1st. The amount of this year's PFD is $1,000. You can check your eligibility online or call the PFD division at 907-269-0370. Again, 269-0370. Regarding the election, Alaska's primary election will be Tuesday, August 18th. Polls will be open for in-person voting from 7 a.m. to 8 p.m. on that date. The Division of Elections will not be utilizing mail-in ballots for the August primary. If you have health concerns, Stevens recommends you request an absentee ballot from the Alaska Division of Elections. You can get more information on absentee voting and register to vote or update your registration at elections.alaska.gov or call toll-free 866-952-8683. Again, toll-free 866-952-8683. And that is the end of that document. Speaking of important phone numbers, as we wrap up here, don't forget about the new 424-INFO. If you wanted to be able to call and talk to our local, knowledgeable representatives to access resources, get questions answered, share, comment, that's what they're there for. They encourage you to utilize it. 424-INFO, I-N-F-O. Again, the big news of the day is the City Council meeting at noon. See it live on their YouTube channel, particularly if you want to participate. If you're occupied and need to see it later, they will archive it at some point on their YouTube channel. We also archive special meetings as soon as possible on ours, youtube.com/CordovaTV. That's where you can also find this program if you missed it or want to share a link to it. youtube.com/CordovaTV. A big thanks, as always, to Cordova Wireless Communications for their sponsorship of this show and their support of local radio in general. Everything we do in local commercial radio is made possible by the sponsors and the advertisers. And particularly at a weird time like we're in now, the fact that they're continuing to keep us on the air is very, very much appreciated. CTC and Cordova Wireless are some of our largest, obviously, but every single one that is with us, because we don't receive grants, there's no government assistance. The only thing the government does with our operation is take money. The FCC collects fees. We actually get to pay for the privilege of being regulated every year with FCC regulatory fees. But they certainly don't provide any money. That doesn't happen at the federal or state level. We have some local advertising, obviously, that's done, and we appreciate that when the city lets us get the word out through our advertising options. But it's the local businesses that far and away make it all work. And a big thanks again to Cordova Wireless for their role in this program and other parts of what we do. Anything that we had to pass over in the 10 a.m. hour will be brought to you next. We thank you again so much for listening. Participate in this afternoon's council meeting if you have something to say or want to listen and be sure you know what's going on. And we'll see you the next time that a town meeting talk show is necessary. It's an on-demand talk show. We do it when it's needed, and we look forward to the next one on KLAM.